6th of October is recognized as a day for whole world to come together to encourage 70 million people around the globe to look beyond their disability. In this video session, we will be discussing cerebral palsy in details. Cerebral or cerebrum refers to the affected part of the brain. Palsy refers to the brain lesion or brain injury causing movement disorder. More important than anything else here, remember, cerebral palsy does not get worse over time. This means that the brain lesion which caused cerebral palsy will not produce any further degeneration of the brain. Therefore, cerebral palsy is defined as static, non-progressive disorder of movement and posture resulting from the injury to developing brain. Cerebral palsy affects movement, posture, balance, and coordination. Although it's a movement disorder, remember, the muscles remain unaffected. Actually, it is the brain that is unable to send signals to command muscles when to contract and when to relax. Few of the early signs of cerebral palsy include stiff or floppy posture. The baby is unable to lift his head up while sitting or when suspended upside down. Fatigue, high-pitched cry, and feeding difficulties have also been observed. In late infancy, the baby is unable to grasp objects, roll over, or sit independently. After 1 year of age, the baby may sit adapting W sitting pattern. That is, the baby sits with his legs internally rotated and knees flexed. You would wonder, a normal baby sits that way too. Yes, babies do sit in W sitting pattern. This is because they find it easy and comfortable. However, babies with cerebral palsy adapt W sitting pattern to compensate for core muscles weakness by leaning forward and stabilizing their body with their hands. The babies may be seen bottom shuffling. This is when they sit on their bottom and move by dragging themselves rather than crawling. Alright, now that we know what is cerebral palsy, in the coming video we will be discussing the possible risk factors that can lead to cerebral palsy. So, stay tuned. Cerebral palsy etiology. Different causes of cerebral palsy can occur at different periods of development, shown by the timeline here. Prenatal events occur before birth. Perinatal period refers to the short period immediately before and after birth. Postnatal period is after the baby is born. Most of the events that cause cerebral palsy happen around the prenatal period. Exposure to radiations and certain medications during intrauterine life can cause brain injury. Intrauterine infections. Infections that fetus may get from his mother during development. These include TORCH infections. TORCH is a mnemonic for toxoplasmosis, rubella, cytomegalovirus, herpes simplex virus, both HSV1 and HSV2. O stands for others such as syphilis, varicella, and parvovirus. Hypoxia. There are conditions in which the developing brain does not get enough oxygen during intrauterine life. As placenta is responsible to get oxygen-rich blood from mother and supply to fetus, so any placental abnormality like placental abruption, for example, can lead to inadequate oxygen supply to fetus, thus causing brain damage. Umbilical cord compression can also reduce the blood supply to fetus. Perinatal risk factors include birth-associated risk factors such as Premature birth. Premature birth is when the baby is born before 37 weeks of gestation. The brain of premature baby does not get enough time to develop, therefore is fragile and susceptible to injury, like periventricular leukomalacia or PVL. Peri means around, ventricular is for the brain ventricles, leuco means white. PVL refers to injury to white matter around the lateral ventricles. What happens in PVL is that there is insufficient blood supply to premature brain, so the white matter around the lateral ventricles die, leaving fluid-filled cysts. Intraventricular hemorrhage. The premature baby also has fragile blood vessels around the ventricles, which can rupture, and the blood may enter the ventricles. The ventricles then dilate and compress the blood vessels around, leading to ischemia of periventricular tissue. Labor complications, including birth trauma, can be due to maternal pelvic anomalies or fetal malpresentation, fetal macrosomia, or can result from the use of forceps during delivery. Birth asphyxia, inadequate oxygen supply during or right after the birth, can cause significant brain damage. Postnatal risk factors. These include head injury from motor vehicle accident, for example, or from fall or lack of oxygen due to near-drowning incident. Strokes. Strokes don't just happen in adults, they can happen in infants too. Brain tumors can also cause CP. Infections including meningitis, which is the inflammatory condition of protective covering around the brain called meninges, and encephalitis, which is the inflammatory condition of brain tissue itself. One important risk factor of CP is contractures. It is the brain damage that occurs due to high bilirubin levels. When there is excessive hemolysis of newborn RBCs, it results into hyperbilirubinemia, as bilirubin is one of the degradation product of RBCs. This bilirubin then enters the brain and crosses blood-brain barrier and damages the brain tissue, particularly the basal ganglia. Genetic mutations. These are few and rarely happen. A mom or dad may pass a mutated gene to their child. However, little research work is available regarding genetic risk factors that cause CP, and much more is still needed. So, this was all for the etiology of cerebral palsy. Spastic cerebral palsy. It is the most common types of cerebral palsy and is characterized by spasticity. Spasticity is defined as abnormal increase in muscle tone, which results from loss of inhibitory pathways. For example, this is a neuron here, and this one is a GABAergic neuron which secretes GABA. GABA is an inhibitory neurotransmitter. It inhibits the neuronal excitation by preventing the transmission of nerve impulses. In spasticity, the neurons fail to receive GABA, therefore these neurons overfire, causing muscles to contract continuously, leading to hypertonicity. In other words, muscle stiffness or tightness. Loss of neuronal inhibition also leads to hyperreflexia or exaggerated reflexes. Spastic cerebral palsy has 3 types, but before we discuss them, you need to know about cortical homunculus first. Our brain has a pictorial representation of parts of cerebral cortex responsible for movements and sensation of different parts of the body. For example, the lower limb is represented on the medial surface of cerebral cortex, This implies any lesion on the medial surface of the cerebral cortex will cause lower limb paralysis. Similarly, any injury to the lateral surface of cerebral cortex will cause upper limb paralysis. Now suppose a person develops lesion on the left cerebral cortex involving the lateral and the medial surfaces. This will cause paralysis of upper limb and lower limb on the right side. And this condition is known as hemiplegia. Injury to the right side of the brain causes paralysis of the left side, and injury to the left side of the brain causes paralysis of the right side of the body. This is because the descending neurons cross over to the opposite side at the level of medulla. Now suppose a person develops injury to the medial surfaces of both the right and the left side. This will cause paralysis of both lower limbs, and this condition is known as diplegia. If a person develops lesion of entire motor cortex, both on the right and the left, this will lead to the paralysis of all four limbs, and this condition is known as quadriplegia. This is all for the spastic cerebral palsy. Dyskinetic cerebral palsy, also known as ethetoid cerebral palsy. It develops due to lesion in basal ganglia. Basal ganglia is a group of nuclei that lie deep within the cerebral hemispheres. Basal ganglia consists of lentiform nucleus, globus pallidus, putamen, and caudate nucleus. The main function of basal ganglia is to prevent unnecessary or unwanted movements. So when basal ganglia is damaged, the child is unable to prevent unwanted movements, therefore develops involuntary movements. There are several types of movement disorders associated with dyskinetic CP. Let's discuss them. Dystonia. It is involuntary muscle contraction producing twisting movement and abnormal posture. One of its presentation is blepharospasm, which is involuntary blinking of eyes. Hands dystonia. It is characterized by involuntary movements of fingers and hands while performing a specific task like writing. Hands is also called as writer's cramp, or while playing any musical instrument, so is also known as musician cramp. Cervical dystonia. It affects the neck region. Oromandibular dystonia affects face, jaw, and tongue, causing involuntary movement of jaw and tongue protrusion. Patient may also present with chorea, which is involuntary random dance-like movements that makes the child appear uncoordinated and clumsy. Ethitosis. It is involuntary slow writhing movement, mainly affecting the distal parts like hands, fingers, and toes. That's all for dyskinetic cerebral palsy. So far we have learned that spastic cerebral palsy is due to lesion of cerebral cortex and dyskinetic cerebral palsy is due to lesion of basal ganglia. Now we will be discussing ataxic CP. Ataxic cerebral palsy is a rare form of cerebral palsy. It develops due to lesion of cerebellum. Cerebellum is a part of hindbrain and lies near the brainstem. The main function of cerebellum is to maintain balance and coordination. Ataxic CP is characterized by poor balance and lack of coordination. Now let's discuss the features of ataxic CP. It is characterized by tremors, which get more obvious while reaching for a thing or performing an activity, such as picking up a pen. They are called intention tremors. This is because they are more obvious when you intend to perform a motor activity. With ataxic CP, children are seen having wide-based gait. To keep their balance, children with ataxic CP walk with their feet wide apart. This is called wide-based gait. The lesion in cerebellum can also affect speech and language. Patients with ataxic CP can have scanning speech. Now, what's scanning speech? In scanning speech, the words are broken down into syllables with long pauses in between. Like, the baby won't be able to say lollipop in a go. Rather, he would say it as law-li-pop, maybe. This was all for ataxic CP. Complications of cerebral palsy. Now that we know cerebral palsy results from inadequate brain development, so there is intellectual or cognitive disability, speech or communication problems, seizures, visual abnormalities such as strabismus. Visual abnormalities are due to spasm of ocular muscles in cerebral palsy, and hearing impairment. Other complications include scoliosis, hip dislocation or subluxation, and joint contractures due to spasticity. All of these conditions can lead to chronic pain at various sites of the body. Spasm of gastrointestinal tract muscles can reduce bowel mobility or peristalsis, leading to dysphagia and constipation. Dysphagia or difficulty in swallowing can cause salivary secretions to accumulate in mouth, leading to sialorrhea or drooling of saliva. These secretions, when aspirated, can lead to aspiration pneumonia. As cerebral palsy affects mobility, skin pressure ulcers develop in bedridden patients. So, when we have patients with cerebral palsy, we have to deal with a number of complications which require a multidisciplinary management approach. Cerebral palsy diagnosis. Although there isn't one single exam or test that can confirm cerebral palsy, a series of observations, screenings, CT scans, and tests over the first months to years of life will be used to make a diagnosis. Medical history. Doctors will want to know about the child's prenatal history as well as any complications during pregnancy and labor. Neurological examination. In the case of cerebral palsy, developmental motor delay is a key indicator. Doctors should evaluate muscle tone, movement coordination and control, posture and balance, fine motor function and gross motor function, also reflexes. Cranial imaging studies help to evaluate brain damage and identify persons who are at the risk of cerebral palsy. These include cranial ultrasounds, CT scans, and MRI. Numerous other tests and evaluations help in the diagnosis of associated complications of cerebral palsy. These include speech and language testing, hearing tests, vision tests, oral motor tests including feeding and swallowing evaluations, gait testing as well, which evaluates any problem with walking. As cerebral palsy results from permanent brain injury, therefore it cannot be cured. However, we adapt a multidisciplinary approach to treat the associated complications. Let's discuss the medical management first. Antispasmodics are prescribed to treat spasticity, which is one of the major issues and can cause severe pain, joint contractures, and weakness. Antispasmodics are two types: centrally acting and peripherally acting. Centrally acting drugs are those which cross the blood-brain barrier and act within the central nervous system, like baclofen and diazepam. Peripherally acting drugs are those which do not cross the blood-brain barrier and act on local nerve endings, like botulinum toxin and dantrolene. Analgesics for pain management and anticonvulsants to stop seizures. Surgical management include orthopedic intervention to correct contractures and bone malalignments. Dorsal rhizotomy. It involves cutting off some nerves in lower spinal cord to relieve leg stiffness. Physical therapy to improve muscle stretch and walking. Occupational therapy to enhance functional abilities. Speech and language therapy to reduce oral muscles weakness and fatigue. Nowadays, stem cells are being explored for the treatment of cerebral palsy. Stem cells are multipotent progenitor cells that have regenerative as well as growth-stimulating properties. As they release growth factors, they have potential to promote recovery of injured brain tissue by replacing neurons and damaged oligodendrocytes. That's all for the management of cerebral palsy.